Hello and welcome to Cocoa Pods, Maternal Mortality Reduction Academy. This is a feature of the Birth Center for Natural Deliveries Foundation. We are recording live from the rural city of Forsyth, Georgia. My name is Dr. Bola Sagadi. I'm a board-certified obstetrician, gynecologist, minimally invasive robotic gynecologic surgeon, and a proponent for natural child delivery. I am fortunate to have with me today certified nurse midwife, Kim Holderfield. We are going to talk about and explore some of the issues that affect maternal mortality in rural cities in America. Kim, welcome, and how are you doing today?
Oh, Dr. Sagade, I'm doing well. I did have my second COVID vaccine, so I'm a bit under the weather, but, we've got to get to the end of this pandemic.
Thank you. Thank you so much for coming. So, Kim, I want you to talk about how OBGYNs and midwives and other personnel involved in providing obstetric care, especially in rural areas, how can we all work collaboratively such that we can work together as a group and actually reduce maternal mortality one step at a time?
Well, in Forsyth, for example, we only have one OB in the whole county, and that is yourself. Most of the women here have to travel to Macon. Many women in the outer areas, such as Spalding County, Lawrence County, they travel in to either Macon here or north in the Griffin area. So yeah, the access to this area as far as OB providers is pretty limited. It would be amazing if we could get more nurse midwives to help fill the gap where the OBs are kind of centralized in the more populous areas, and that we could maybe, bring in telemedicine. And that has been an issue in the state of Georgia with the Board of Medicine. They have really resisted the fact of using telemedicine with OB care.
And we know for the healthcare providers, we have the OBGYNs at the top of the pyramid with the maternal fetal medicine specialist. We have the certified nurse midwives. We have other midwives. We have doulas. Can you define your role as a certified nurse midwife and how you can work collaboratively with an OBGYN to make sure that women are taken care of in these areas that there's a sparsity of obstetric care providers?
So certified nurse midwives are experts in normal. We take care of normal progression of pregnancy. If something falls outside of the normal, we are trained to recognize that and work collaboratively with our physician OBs. In the state of Georgia, we're required to have physician supervision. So we always work together with our supervising physicians. It makes for a really good relationship of making sure the women have what they need when they need it. If there's a problem, we step up the chain to the OB. If everything is moving, along normal parameters, they stay in that midwifery model of care.
And that's why the American College of OBGYN recognizes the levels of care for maternity care. We have the level 1, which is basic. We have the specialty level, level 2. We have level 3, which is a subspecialty level. And then we have level 4. So women that have normal pregnancies and they are healthy themselves, they can safely work with a certified nurse midwife throughout their pregnancy and delivery. And we can risk stratify. And as long as they remain a low risk pregnancy, they can work with a midwife. Is that correct?
That is exactly correct. So again, we are the experts in normal. When it comes outside of normal, that's where we have our referral base and our collaborative agreements that come into place. But yes, as long as a woman is having a normal pregnancy, all the parameters are stable, she can stay in midwifery care from conception to post-delivery, and we can take care of the baby for the first 30 days of life.
And you live in rural Forsyth, Georgia. And can you speak to some of the factors that contribute to maternal mortality? One of the things I see is that we have, adolescent pregnancies, and a lot of them unintended. Can you speak to maybe some of the ways that we can look into this, because adolescent pregnant women are one of the groups of women at high risk for maternal mortality or severe maternal morbidity, because they are at risk for things like preeclampsia. They're at risk for having a cesarean section because the pelvis is not ready. They're at risk for maybe not following the guidelines and the counseling of the healthcare provider. Can you speak to this problem of, adolescent pregnancy in this area?
Yes. This local area tends to be very Christian-based, and therefore the education that is provided in the school systems is based on abstinence. I feel strongly we should change that and bring in full sexual health education to include STIs, birth control options, general wellness for women, pap smears, things of that nature. It should not just be based on abstinence. Yes, women can make choices, but when they make choices, they should make choices for a birth control that they're comfortable with so that they have control over their bodies. They shouldn't leave it up to, just not engaging in sexual activities just because they're afraid of getting pregnant. We can provide them tools to protect them from pregnancy as well as STIs in the use of condoms. And I think a lot of young women, they don't realize they don't use condoms. Therefore, we have STIs such as chlamydia and things that can cause fertility issues later on with scarring of the tubes and scarring of the uterus. And these things need to be taught to these kids so that they can make choices to protect their women's health so that they can plan for families later.